There's a new skincare trend out there. It's a red light mask that is supposed to rejuvenate the skin. And Dr. Christopher Labos joins us now with his thoughts on this trend. So, Chris, your wife bought one of these and it scared you. Why did it scare you? Show us.
Because it is horrifying to behold. Imagine like having a look at this. It looks like a serial killer mask. Very similar. It is a horrifying thing to behold. It changes lights, as you can see, and it usually flashes red light. But when you're not prepared for it, it can be a shocking thing to see.
Wow. Okay, that is shocking. It kind of looks like something out of Silence of the Lambs or Jason from Friday the 13th, just in time for Halloween.
Yeah.
But this is all based on something called photodynamic therapy. What's that all about?
So, photodynamic therapy has actually been developed to treat certain conditions like skin cancer and certain non-cancerous skin lesions. The basic idea is you apply a cream to your face. When you shine light on that molecule converts light into heat, and that heat then burns the superficial tissue where you've applied it. So you can basically direct the therapy only to the area where you've applied it. So if you're trying to treat a specific area where you have a skin lesion that you want to get rid of, you can essentially burn it away in the same way that you would with sort of cryotherapy or other dermatological techniques. So there is valid science to this, which actually has been part of some clinical trials.
But it was supposed to treat cancerous and precancerous lesions of the skin, right? And now people are using it on their whole face. So is that
Yeah.
okay?
Well, it's okay in that, whenever you develop a new technology, a new medical therapy, there's always going to be indication creep where people keep using it for, a broader and broader array of conditions. And it has been tried. There have been a number of what are called split face studies where basically people will take a mask like this, apply the cream to one half of their face, leave the other half bare as a placebo, and look to see if there's a difference. And there is some limited evidence that, yes, it maybe will help a little bit in terms of reducing the appearance of fine lines and wrinkles. When people have reviewed the evidence base on this, it's a little bit uncertain because there is such a variability in techniques. I would say there is maybe some limited evidence that photorejuvenation therapy, as it's called, might potentially do something.
Even split face testing doesn't sound very good. But so there's a little bit of evidence that it might work. Is there any potential harm here, though?
Well, the real harm here is that if you're going to be shining a light, because this is sort of a bright light, if you were to shine it directly into your eyes, that could potentially be dangerous. I mean, it's the same thing that we talk about with like laser pointers. Don't get them directly into your eyes, obviously. So that's a possibility. People have experienced like warmth, like a burning sensation. So there can be some sort of thermal effects on the skin. That is an issue as well. And so there are certain concerns there. Specifically with regard to treating it for skin cancer, though, while it is effective, it is generally felt that a surgical excision is probably the better course of action. The recurrence rate tends to be a little bit higher with photodynamic therapy rather than surgery. It's just that the cosmetic results is better compared to something like cryotherapy. So it's an acceptable form of therapy, but maybe not the most effective if you want to just cut away all of the cancer, which is the advantage you have when you're doing surgery.
Yeah, and at a cost of $650 and more, maybe you want to spend that on something else. Well, thanks so much for this, Christopher. Nice to see you.
My pleasure. Take care.